Flail chest. Flail chest is frequently a complication of blunt chest trauma from a steering wheel injury. It usually occurs when three or more adjacent ribs, multiple contiguous ribs, are fractured at two or three more sides, resulting in free floating rib segments. It may also result as a combination of fractures of ribs and costal cartilages or sternum. As a result, the chest wall loses stability and there is subsequent respiratory impairment and usually severe respiratory distress. Pathophysiology. During inspiration, as the chest expands, the detached part of the rib segment, flail segment, moves in a paradoxical manner, pendulum movement, in that it is pulled inward during inspiration, reducing the amount of air that can be drawn into the lungs. On expiration, because the intrathoracic pressure exceeds atmospheric pressure, the flail segment bulges outward, impairing the patient's ability to exhale. The mediastinum then shifts back to the affected side. This paradoxical action results in increased dead space, a reduction in alveolar ventilation, and decreased compliance. Retained airway secretions and atelectasis frequently accompany flail chest. The patient has hypoxemia, and if gas exchange is greatly compromised, respiratory acidosis develops as a result of CO2 retention. Hypotension, inadequate tissue perfusion, and metabolic acidosis often follow as the paradoxical motion of the mediastinum decreases cardiac output. Medical management. As with rib fracture, treatment of flail chest is usually supportive. Management includes providing ventilatory support, clearing secretions from the lungs, and controlling pain. The specific management depends on the degree of respiratory dysfunction. If only a small segment of the chest is involved, the objectives are to clear the airway through positioning, coughing, deep breathing, and suctioning to aid in the expansion of lung and to relieve pain by intercostal nerve blocks, high thoracic epidural blocks, or cautious use of intravenous opioids. For mild to moderate flail chest injuries, the underlying pulmonary contusion is treated by monitoring fluid intake and appropriate fluid replacement, while at the same time relieving chest pain. Pulmonary physiotherapy focusing on lung volume expansion and secretion management techniques are performed. The patient is closely monitored for further respiratory compromise. When a severe flail chest injury is encountered, endotracheal intubation and mechanical ventilation are required to provide internal pneumatic stabilization of the flail chest and to correct abnormalities in gas exchange. This helps to treat the underlying pulmonary contusion. Severe serves to stabilize the thoracic cage to allow the fractures to heal and improves alveolar ventilation and in intrathoracic volume by decreasing the work of breathing. This treatment modality requires endotracheal intubation and ventilator support. Differing modes of ventilation are used depending on the patient's underlying disease and specific needs. In rare circumstances, surgery may be required to more quickly stabilize the flail segment. This may be used in the patient who is difficult to ventilate or the high-risk patient with underlying lung disease who may be difficult to wean from mechanical ventilator. Regardless of the type of treatment, the patient is carefully monitored by serial chest X-rays, arterial blood gas analysis, pulse oximetry, and bedside pulmonary function monitoring. Pain management is key to successful treatment. Patient controlled analgesia, intercostal nerve blocks, epidural analgesia, and intrapleural administration of opioids may be used to control thoracic pain. Thank you.